Good morning. I am Diana Gishengo. When people get titles of HSC, CBS, for now I am a HRD, a human rights Diana Gishengo HRD. It's definitely an honor, and like has been stated by the three speakers who made the opening remarks, it is that time of the year that we must ultimately take power back. Take power back that we gave to people who we are not sure whether they utilized it well. We suffered through COVID, okay? And Dr. Mercy here will tell stories of health workers and what they have to go through in hospitals that are supposed to be resourced by government. So we'll have a mantra, and it will be Afya Nation, and you respond health first. Okay? Afya Nation.
Health first.
Afya Nation.
Health first.
Aya, ikibamba sana tunaingia Afya Nation, health first. Sawa sawa? Okay. And so that when you're invited to that political rally, when you meet that MCA aspirant, that MP aspirant, gubernatorial president, you remind them, Afya Nation.
Health first.
Thank you very much. So we'll go into this, and because you can see we have a doctor, I will go to where I can thrive, and then she will go into the details of medical engineering. Nilisoma, lakini sikusoma miaka 6.
Nilisoma miaka 8.
Billy, you're able to, oh, we are good now? Okay. So we are in the preamble where we, the people of Kenya, is given power by the Constitution, reiterating the right to the highest attainable standard of health, reiterating that the right to the highest standard of health is inalienable in our Constitution of Kenya and international human rights instrument. This right has been severely undermined by structures, policies of state bureaucrats and institutions. We are envisioning the revitalization of health infrastructure that will promote health, prevent disease, and guarantee the provision of equitable, affordable, and high-quality healthcare, thereby improving health status of individuals, families, and communities.
Afya Nation.
Hakuna kulala. Acknowledging that the right to health is a fundamental public good, the majority of Kenyans, including 70% of Kenyans who work in the informal sector, still cannot afford quality and timely healthcare services. These Kenyans have lost their lives. They have been pushed to poverty, noting that this scenario or state is aggravated by action that put profit over people. Further, aware that preventive and community health care form the core of the long-term approach to addressing the health crisis in Kenya, hence we demand that government allocate substantive resources in attaining that. We desiring working conditions for health workers, including proper and public sector financed advanced training for specialists in all healthcare working cadres. Cognizant that every person has the right to the highest attainable standard of health, which include healthcare services and covers mental and reproductive health, recognizing that healthcare is perpetually underfunded in Kenya, we demand, we have these demands that we'll expound on later, and we continue to advance advocate for public sector-driven universal health care, and we honor those who heroically struggle to bring equity and equality in providing healthcare services to all Kenyans, especially during the COVID-19 pandemic, to realize, so that in the long run, we are able to realize community-based planning, budgeting, and monitoring of healthcare. We continue to remember people who lost loved ones due to the poor state of health or sank deeper into poverty due to the unmanageable cost of healthcare. And based on this particular background, we are about to propose to you what we have gathered from views of experts, patients, and Kenyan as the People's Health Manifesto. Afya Nation?
Health first.
Afya Nation?
Health first.
Aya. So we have identified 4 key areas, very, very broad areas that we would like you to remember. And if there is somebody who is creative enough to give us a rhyme or something that can sharpen this, so that everywhere people go, they are able to remind all the aspiring political class that these are things that count in this country if we are to repair and rebuild a healthy nation. First, we need to invest in community and public health. Secondly, we need to ensure that each nimeruka kidogo. Afya Nation?
Health first.
Afya Nation?
Health first.
Aya. This is the first one. Promote health through prevention. Sawa sawa. Do we want to go to hospitals? Or we want to be healthy?
We want to be healthy.
Community health workers and volunteers, watu wende hospitali ama wakuwe na afya nyumbani? Okay, so to do that, kwanza, we need to invest in community and public health. Level 1 hospitals. Okay? We need to ensure that the government is committed to the fact that every household has a balanced diet. Every household has access to clean water. Every household has access to sanitation, a toilet or a pit latrine. Okay? When COVID came, we washed our hands, and they are called diarrhea diseases. Zikapungua hizo. Daktari yako hapa. Then, secondly, the chair of the health workers informed us that currently in Nairobi, every health worker, community health volunteer, covers 100 households. That is 1 too many. Now we are saying tukate hiyo nusu kwanza, so that every community, hatuwaiti volunteer, ni wafanyikazi. Sindio? Na walipwe. Every community health volunteer now covers 50 households. We are also proposing that we introduce, the people want comprehensive health education. Okay? We need to be educated on the basics of health. Health students, hatuna ubaya, hatutasoma medicine, tunasoma health. Okay? So that people are able to cater for their mental health needs, sexual and reproductive health needs, and so on. And finally, ensure access to water and clean sanitation for all across the country. Afya Nation? Afya Nation? Okay.
Afya Nation. Afya Nation. Why are we not? Mbona tuipati nguvu? Afya Nation. Thank you very much. I think everyone else introduced me, so I'll just move on to present the other parts of what we propose as our demands to the political class as we move into this electioneering period. we need to remember that we are the ones that give them the mandate. Therefore, we have to claim what is constitutionally, rightfully ours. Healthcare is rightfully ours. Quality healthcare is rightfully ours. So we must demand for it. It's no longer a privilege. It's no longer a favor that when you go to a health facility, you get served. It is your right. And that is what we must, demand. And that's why we are here today. So I think Diana mentioned that we collected views. At this point, I might just say we collected views from 11 counties across the country, from healthcare workers across the country. We had very many sessions with community health volunteers. The CHVs in the house, you remember? Si tumekutana, tukazungumza hii maneno, si ndio? And now we have put it on paper, and we continue to advocate and push for these things. So secondly, as we make this demand, we demand a public sector-driven universal health care. So we demand that the government that will come into power must guarantee universal health care. So how do they go about doing this? That 15% of the national budget will be dedicated to health care. Remember, Kenya signed the Abuja Declaration, and they are yet to get there. We are still at 6%, a 9% gap. We are demanding that this gap be bridged, and 15% of the national budget be dedicated to health, and 50% of the county's budget needs to go into healthcare, because we recognize that health is a devolved function, and level 1 to level 5 healthcare facilities are the responsibilities of county government, and therefore a lot of budgetary allocation needs to go to that. Then we must ensure that the government of the day must ensure that 100% enrollment, every single Kenyan, irrespective of whether they can afford or they cannot afford, they should be enrolled into NHIF. And the funds from NHIF, at least 85% must be spent in our public health facilities. And my SG will say that more than 85% of those funds should go to public health facilities, so that we are strengthening our public health facilities, so that when you go there, you don't miss the services that you need. And then lastly, not lastly, but we need to expand the resourcing of NHIF, so that it's a hybrid system. There's tax, and then there's contribution from individuals, so that we sustain this fund, and it's able to provide coverage to every Kenyan. And lastly, every Kenyan should have access to the entire range of primary health care services at all our public facilities at no cost, so that we are not seeing Kenyans spending out of pocket what they should be spending on food and other things. They're also spending it to buy medicines and to get care, especially primary health care services. So we are demanding that this takes place, and the primary health facilities are strengthened, and Kenyans access care at no cost. Then we also are making the demand that the government of the day, or the government that will come into power, must expand and strengthen public health care facilities. The government of Kenya has a standards and norms, a document that they worked on with experts. It's out there in the public, however, this has never been implemented. That has tied healthcare into different levels based on our population sizes, and has given functions to these different levels of healthcare, and giving the very minimal requirements that these facilities need in order to be operational. And so even the demands that we make on this document and we make today, these are just minimal. They are not optimal. They are not meeting the WHO requirements, but they are minimal to make these facilities functional. So we demand that we get 7 additional teaching and referral hospitals. These are level 6 hospitals across the country, so that each hospital is able to serve 5 million people. Remember, these are standards that are set by our government, and so we are demanding that they meet these standards. We are demanding that every county should have a fully functional level 5 hospital. And counties such as Kiambu, Kakamega, Nairobi, that have more than 1 million people need to have more than one level 5 facility. Level 5 facilities will ensure